Hello, and welcome to Nurse Mastery Academy. In today's lesson, we are focusing on potassium imbalances, hypokalemia and hyperkalemia. Potassium is one of the most critical electrolytes in the body. It plays a major role in cardiac rhythm, muscle contraction, and nerve conduction. The most important concept to remember is this: potassium controls the heart. Because of this, any imbalance in potassium levels can quickly become life-threatening and must be treated as a priority. Normal potassium levels range from 3.5 to 5.0. Let's start with hypokalemia. Hypokalemia occurs when potassium levels fall below 3.5. Low potassium makes cardiac cells less excitable, which weakens muscle contraction and disrupts normal heart rhythms. In simple terms, low potassium weakens the heart. Common causes of hypokalemia include vomiting, diarrhea, excessive laxative use, and loop diuretics such as furosemide. Other causes include insulin administration and alkalosis, which shift potassium from the bloodstream into the cells. When assessing a patient with hypokalemia, always review recent fluid loss and medication history. Signs and symptoms of hypokalemia include muscle weakness, leg cramps, fatigue, and constipation. Cardiac changes are the most dangerous and include flattened T waves, the appearance of U waves, and various dysrhythmias. Because of these risks, any patient with hypokalemia should be placed on continuous cardiac monitoring. Treatment of hypokalemia focuses on potassium replacement, either orally or intravenously. Intravenous potassium must always be given slowly and never as a bolus, because rapid administration can cause fatal cardiac arrhythmias. Nursing priorities include monitoring the heart rhythm, checking kidney function, and reassessing potassium levels frequently. Now let's move on to hyperkalemia. Hyperkalemia occurs when potassium levels rise above 5.0. High potassium makes cardiac cells overly excitable at first, then unable to repolarize, which can lead to lethal arrhythmias. The key idea to remember is this: high potassium can stop the heart. Common causes of hyperkalemia include kidney failure, potassium-sparing diuretics, AC inhibitors, and excessive potassium intake. Cellular breakdown, such as burns, trauma, or tumor lysis syndrome, can also release potassium into the bloodstream. Always assess renal function first when hyperkalemia is suspected. Symptoms of hyperkalemia include muscle weakness, numbness, and tingling. Cardiac changes include tall peaked T waves, widened QRS complexes, and ventricular dysrhythmias. Hyperkalemia is a medical emergency. Treatment focuses on protecting the heart and lowering potassium levels. Calcium gluconate is given first to stabilize the cardiac membrane. Insulin with glucose is used to shift potassium back into the cells. In severe cases, dialysis may be required. Nursing priorities include continuous ECG monitoring and frequent reassessment of potassium levels. Now let's practice with NCLEX-style questions. Question 1. A patient with hypokalemia is most at risk for which complication? A. Hypertension. B. Cardiac dysrhythmias. C. Pulmonary edema. D. Hyperglycemia. The correct answer is B. Cardiac dysrhythmias. Question 2. Which ECG change is expected in a patient with hyperkalemia? A. U waves. B. Flattened T waves. C. Peaked T waves. D. ST depression. The correct answer is C. Peaked T waves. Question 3. Which medication places a patient at the highest risk for hypokalemia? A. Spironolactone. B. Furosemide. C. Lisinopril. D. Losartan. The correct answer is B. Furosemide. Question 4. Why is intravenous potassium never given as a bolus? A. It causes hypotension. B. It causes hypoglycemia. C. It can cause cardiac arrest. D. It causes respiratory depression. The correct answer is C. It can cause cardiac arrest. Question 5. Which potassium level requires immediate provider notification? A. 3.4. B. 3.8. C. 5.8. D. 4.2. The correct answer is C. 5.8. Question 6. Which symptom is most concerning in hypokalemia? A. Constipation. B. Muscle cramps. C. Fatigue. D. Irregular heart rhythm. The correct answer is D. Irregular heart rhythm. Question 7. Which medication is used to stabilize the heart in hyperkalemia? A. Insulin. B. Calcium gluconate. C. Kayexalate. D. Furosemide. The correct answer is B. Calcium gluconate. Question 8. Which patient is at highest risk for hyperkalemia? A. A patient on loop diuretics. B. A patient with chronic kidney disease. C. A patient with diarrhea. D. A patient receiving IV fluids. The correct answer is B. A patient with chronic kidney disease. Question 9. Which assessment finding suggests worsening hyperkalemia? A. Bradycardia with peaked T waves. B. Flat T